Hello, can you hear me? Shall we begin? Okay, somebody respond in the chat. Gurdeep Sandhu. Rachit, you are already here. Happy Navratri, happy Durga Puja. Dr. Aarti, can you hear me? Shall we begin? All right. So we are here on this festival evening of Saptami with INICET Predictor series. So INICET Predictor series has been started yesterday by my colleague friend Dr. Deepak sir, and you attended ENT session probably. So as far as INICET Psychiatry is concerned, we can expect 5 to 6 questions on different topics. The favorite topics of INICET has been number one, psychopharmacology. They ask more of psychiatry drugs rather than the psychiatric diseases itself, mainly lithium, valproate, carbamazepine, the mood stabilizer segment, SSRI, TCA, the antidepressant segment, and antipsychotic side effects. These are the favorite topics. Most of the students are aware about these favorite topics. The second favorite topic of INICET has been de-addiction. And the third is child psychiatry and other clinical psychiatry. Let's see that the questions that I have brought for you today. First one is general psychiatry. Actually, it is a modification from PYQ. They have asked stupor. Do you know what is stupor? Can you match stupor? Just match stupor out of the four things. Which of these four is stupor? Two, okay. Which of these is coma? Okay. Which of these is a lethargy? See, the levels of consciousness are L, O, S, C, loss of consciousness. One is a alert. Then comes lethargy. Then comes obtundation. Then comes stupor. And finally comes coma. Will you remember the sequence? LOSC, loss of consciousness. LOSC. This is the right answer here. What is lethargy? It is a severe drowsiness when the patient can be around but drift back to sleep. When the patient is lethargic, if you don't keep on arousing, he will go to sleep. If you don't keep on arousing, he'll go. Obtundation is even more severe form of reduced alertness, where the patient is less responsive and takes longer time to react to external stimuli. Stupor responds to vigorous stimulation and coma does not respond. Once again, LOSC. Lethargy, obtundation, stupor, and coma. Coma does not respond. Stupor responds to vigorous. Lethargy, if not stimulated, will sleep. Obtundation mode. Were you aware about these terms? So suppose INICET asked these terms for the first time. INICET asked Oniroid in 2020, and that was a new question. Before that, Oniroid was not asked. INICET asked Twilight. So on the same page in the textbook of psychiatry mental status examination by Strub and Black, where they have explained the terms Oniroid, Twilight, they have also explained obtundation, stupor, and coma. So oneroid has been already asked, obtundation can be asked. Am I clear? This was the first question, a new question for you. Second is a doable question. Come on. Strange speech behavior. Glumpish. Have you heard this word? Glumpish. The feeling that you get when the sun dances on your hands. Sun dances on your hands. Sun dances on your hands. Come on. Is it a new word that has a meaning for the patient but not for us? What do you call it? Neologism. Could you do this one? Could you figure out this question? It's not word salad. Word salad is meaningless repetitions of words. Out of context of the normal speech. What is perseveration? Giving same answer to every question. Answering same beyond the point of relevance. These terminologies are important. One type of question in psychiatry is called terminologies. You are supposed to know the terminologies. When words are linked to each other by rhyming, we call it clang associations. We call it clang associations. Has anyone seen these questions? I have been doing a discussion on these questions without video on Instagram, WhatsApp, Telegram group. Weekly quiz has been going on, and I am in the last 2 weeks of the quiz. General psychiatry, followed by psychotic disorders, followed by neurotic disorders, mood disorders. One by one, every week, I am conducting a quiz, and these are the questions that I selected for today's session from the quiz. Has anyone seen these questions? There's an Instagram group, there's a Telegram group, wherever you must have seen. Check out this one. Mute maintains rigid posture and shows waxy flexibility. Again, INICET 2020 modified question. If you are making notes, can you mark that Dr. Sachin said in INICET Predictor, catatonia has been a previous AIMS favorite topic. Catatonia has been asked in the previous AIMS. This is catatonia, waxy flexibility, for which the first line treatment is IV lorazepam, although the best treatment is ECT. The first line treatment is IV lorazepam, although the best treatment is ECT. Were you able to solve this one? Were you able to solve this one? A man has been treated with schizophrenia, has been treated with risperidone for 6 months. Gynecomastia and sexual dysfunction. Come on. Gynecomastia and sexual dysfunction. These are the side effects of hyperprolactinemia. Hyperprolactinemia. Hyperprolactinemia happens due to blockade of dopamine. Come on, what is the answer? Have you heard about tuberoinfundibular pathway? Hypothalamus to anterior pituitary, D2 antagonism. I mentioned antipsychotic side effects. Predicted question. Already asked INICET 2022. Tuberoinfundibular pathway. Due to blockade of dopamine, it causes hyperprolactinemia, and increased prolactin causes gynecomastia and sexual dysfunction. Were you able to solve this? Were you able to solve this question? All right, very good. This question I have given in previous class test also, but it is a frequently mistaken. Can you solve it? Frequent mistakes have been done in this question. Can you solve it? 60-year-old man whose wife died 3 months back. Intestine have rotten away. Intestine have rotten away. Have you heard this somewhere? Intestine rotten away is delusion of nihilism. My intestine have rotten. Secondly, he is responsible for the death of his wife. Is delusion of guilt. Come on. Were you able to answer this? Yes. This is a case of depression with psychotic symptoms. First of all, grief is not a psychosis, grief is a neurosis. For the students who have answered grief, grief is a neurosis. And it is 3 months, it's not a part of the normal grief itself. It is not schizophrenia. Do you know depression with psychotic symptom have mood congruent delusions and hallucinations as per the mood? Mood congruent delusions and hallucinations. Were you able to answer this question? Were you able to answer this question? This question is important. Delusion of nihilism and delusion of guilt are seen in a patient of depression. Delusional disorder will have only single delusion in the absence of anything. Only delusion. It is in the context of wife died 3 months back and now started to believe. Now started to believe. Now means last few days. Delusional disorder has to be present for longer duration. Delusional disorder is Othello syndrome, infidelity, then de Clermont syndrome, delusion of love, etc. etc. Basic definitions of neurotic disorders. Panic disorder has been a PYQ. Come on. Match the column is a frequently asked type of question in INICET. Do you know this? They ask match the column questions. Because the wife died, Cotard is actually severe depression with psychosis itself. Cotard is severe depression with psychosis. Correct you are. A is 3. Where would you match B? 1. All right. Where would you match C? 4. All right. Where would you match D? 2. 3142. The basic definitions. Are all of you aware? Anxiety disorders are divided into GAD, panic, and phobia. And phobia itself includes specific phobia and social phobia. Social phobia now is known as social anxiety disorder. Was this question doable? If you were able to do this question, then you have good basics. Good basics. Basic understanding of your psychiatric symptoms are good. See, all the questions are not going to be difficult in INICET. Suppose you will see 6 questions in INICET, 3 questions will be basics, 2 questions will be advanced, and 1 question will be tricky. Sometime 1 out of 6 questions in INICET is beyond the notes. Some of the questions even I have to think 3 times before giving you an answer. Our target in INICET is 5 on 6. Rather than going for 6 on 6, if 5 on 6 is good, in INICET 5 on 6 in psychiatry is a decent score. Do you get me? 3 questions will be basics, 50% of the paper will be basics, 2 questions will be advanced, and 1 question will be a little tricky. It is organic mental disorders. My typist has done a mistake here, but chapter doesn't matter. 60-year-old woman with history of hypertension and diabetes, presents with cognitive decline and gait disturbance. Worsens over the past few months, left side weakness and slow processing speeds. Symptom fluctuate. Left side weakness means post stroke. We are dealing with a case of vascular dementia because there's a history of hypertension as well. So in vascular dementia, what do you expect? Do you expect cortical atrophy? No, I expect it in Alzheimer's. Do you expect neurotransmitter imbalance? That I expect in every dementia, kind of. What do you expect in a cortical dementia? Multiple small infarcts. Were you able to answer this question? Organic dementia is a favorite topic, especially Lewy body dementia. INICET, Lewy body dementia. If this question comes in this November, let me know. All those who have attended the predictor session today or watching it recorded, let me know if Lewy body dementia comes. Were you able to solve this one? Another favorite topic, alcohol withdrawal. Do you know how many times alcohol withdrawal have been asked in AIMS plus INICET? I think 7 times. I can show you 7 PYQs. Confusion, agitation, tremors. Known case of cirrhosis. Liver disease present. Confusion, agitation, tremors. Confusion means most probably delirium because it is present with tremors, delirium tremens. What is the drug of choice? Drug of choice for alcohol withdrawal seizure, diazepam. Were you able to do this question? I will not call it as a tough question. Overall drug of choice for alcohol withdrawal is chlordiazepoxide, but for delirium tremens it is IV lorazepam, and for seizure it is diazepam. Do you get this question? Were you able to solve? Please respond in the chat. I am checking. Yes, lorazepam with thiamine is a PYQ. Lorazepam with thiamine. I have intentionally not put too difficult questions. Child psychiatry. Do you know how many times Rett syndrome has been asked? In the same paper, they asked Rett syndrome two type. Repetitive hand wriggling movements. Do you know Rett syndrome is a PYQ? Normal milestones till 18 months of age, after which she lost her ability to speak and developed hand movement. Deceleration of head growth. Could you figure out microcephaly? Could you figure out microcephaly? Microcephaly is a peculiar feature of Rett syndrome. What is the answer? X-linked dominant inheritance, MECP2 gene mutation. They have asked X-linked dominant. They have asked only females. What is the next question expected? Gene. MECP2 gene mutation. Could you figure out this question? Could you figure out this question? Delay also and regression also. Minakshi. Prader-Willi Down syndrome. Last question of today. Another one of child psychiatry, autism spectrum disorder. Aggressive behavior, hitting his head against the wall, biting himself. Tachycardia, diaphoresis. Come on, give it a try. There are two drugs which have been approved for behavioral abnormality in autistic children. There are two drugs which are approved for behavioral abnormality in autistic children. Do you know the name of these two drugs? Do you know the name of these two drugs? R A Ra, risperidone and aripiprazole. They are approved to control the behavior abnormality. We don't prefer haloperidol because of a higher risk of extrapyramidal side effects. That is very common in autistic children. So we don't prefer haloperidol. What does today's discussion tell you? That what are the predicted topics in psychiatry? What are the predicted topics? Pharma, de-addiction, writing again, child psychiatry, basic terminologies. See, majority of the questions that are asked are from the topics which you have already studied. Okay. My last words. All subjects are important. You cannot tell that in INICET any one subject is not important. Only two questions are coming from anesthesia, so I'll not do anesthesia and go for INICET. I mean, I'm not saying that only two questions come. I'm just giving an example. Number two, main notes revision and command is important. High yield notes is like a garnishing. For DAM students, high yield is INICET, PYT, PYQ, and Mission INICET. All these videos will help you understand the high yield topics for INICET. On the day of the exam, you have to understand that topics are same Question framing is standard. Presence of mind and application of the concept, your mental health on that day, is the most important factor, according to me, for INICET exam. I wish you very, very all the best for INICET exam. That is all I have to say for today's session. It was a very short and crisp session where I discussed the points. Delirium is altered sensorium, stupor is lowering of consciousness. All right, I hope the session was helpful. Please go with a very positive mindset towards INICET. Don't rule yourself out. Don't rule yourself out, because even with not so good rank in NEET PG, you still stand a chance in INICET. Don't rule yourself out. Okay, I hope some of you attending my lecture today mix it into INICET, and I meet you for the interview as a topper, as a ranker. No matter what your rank is, I would like to speak to you, and I would like you to remind me that I told you that it is still possible. That's all from my side. Dr. Sachin Arora signing off. Bye bye. Good night. Happy Navratri. Happy Durga Puja. Stay safe. All the best for your exam.